Okay, so this is our Potenza microneedling with radio frequency. So there's plenty of devices out there. This Potenza is by a company called Cynosure. They are the manufacturer and the distributor. So, which is a good thing when you are looking at devices, because if there's anything that goes wrong with the device, you want to make sure that they are also the manufacturer, they can fix it and whatnot. So why is Potenza different from others? So Potenza is very customizable, and I know a lot of them you can customize. In this case, it comes with, believe it or not, 2 different types of tips, but within the 2 different types of tips, you have 2 different numbers of tips. So for example, there's an I tip, and then there's an S tip. So we're going to use an I tip. You have an I 25 and then an I 49. Same thing with the S tip. You have an S 25, an S 49. So why would you use a 49 over a 25 and whatnot? So the 49, there's more tips. It's really good for, your acne skin and if there's acne scarring. And why would I use an I tip versus an S tip? The I tip, you think of like your darker skin tone. So anyone with melasma, Indian skin, darker skin tones, younger also, you want to use it on more younger skin tones as well. So your I also call it the eyes, like the innocent skin. And then you would use an S tip. So this would be a little S. You would use the S tip for like that saggier skin that needs a lot more tightening, and it's a little bit stronger, the S tip. So so that's why right now we're going to be using the I tip. And then we will start talking about the device. So the device itself comes, now you have to set it. So because we're using one of these, we're gonna be using a bipolar mode. Now it does come with monopolar, and that's called the fusion tip. And the fusion tip's great because you can infuse product at the same time, but we're not infusing today. We're just going to be doing the microneedling with radio frequency. We're gonna use bipolar mode at a 2 megahertz. So that's what we want our settings to be in. Now, we are going to, once we attach the tip, because this is the button to attach the tip, it'll tell us what tip we're going to be using. These are all the tips. Like I said, your commons are your I 49, I 25. This one you don't really use too much of. That's for, certain like a pimple or a cyst. There's your S49, S25. Same thing, pimple or cyst kind of thing. And then here's your fusion tips down here. So that's why the fusion tip is the one that you would infuse. So today we're gonna be using our I-49 tip. I don't know if it's gonna let me attach it because we're not on yet. So let me do that. And then we're gonna go down here. Now, when you start the device, because we're not infusing product, we don't wanna push it in too deep. We're gonna use it at a 5 impact. And that means how hard the needles will penetrate the skin. Not how deep, but how far, how hard, how quick. So that's that. We are going to change our time. So in this patient's case, because of her skin tone and texture, we're gonna have it go over 100 milliseconds. And the reason why we want 100, usually I'm always between 100 and the number 50, right? So there's 50 or 100 is usually where I keep my milliseconds at. 50 I would use for lighter skin tones, and then 100 I would use for a darker skin tone. So that's why we're going to use 100. And then I have the watts. So the watts is how hot it's going to get. So watts are over here. I don't want to use too much watts because of her history of melasma. So I'm going to actually lower it down to about 600. Now, if I were going to be doing a really strong treatment on someone, you want to make sure that this millijoules is ranged between 800 to 1,000. But because I'm going to be watching her with melasma, we're going to keep it at 6 and 600. So my radio frequency, that heat, is lower. It's not as strong. It's still on there, but it's just not as strong. So that's the main part of this. Now, you're gonna see on this part when we get started on the treatment, these are your pulses. And your pulses are how many times it's touched the patient, every time you go to a different area. So you start with 1,000. Now you can max out the tip, but you don't have to max out the tip, but you can. So you start with 1,000 and then you work your way down. So some tips, especially the S tip, you definitely do not need to do a second pass because that tip is a little bit stronger, but you can if you want to. So that's a quick rundown of the Potenza device. So we are going to get started. If there's any questions, follow my YouTube channel for the next episodes. Stay tuned.